Everyone that works in here really cares about the shifts.
At the end of the shift is a patient, so we try and keep that focus.
What we do makes a difference, and if we're not able to fill that shift,
Then obviously there's a patient without a nurse.
We've got staff that will drive from halfway across the state just to go, not let a client down.
And that would mean a country hospital without the support it needs, or a theatre that can't operate. So it's just all about care and loyalty.
Over the last 30 years, the last 5 to 10 in particular, the demands are particularly challenging around staffing. We have 500 staff and nearly 300 volunteers. So how we staff our facilities and our community services in the future are going to be our major challenge.
From a staffing perspective, healthcare is inherently volatile. When you can't perfectly predict patient demand, when you can't perfectly predict your nurse supply, we fill the gap.
Well, Healthcare Australia has got two key operating divisions. It's got what we call a health workforce division, and we've also got a home care services division. We have 15 brands that we actually operate under that effectively reflect the individuality or the category of nurse that we have.
Health Workforce Solutions, it's about 4/5 of Healthcare Australia in terms of revenue. At any point in time, we'd have between 6,000 and 7,000 active nurses at any one of several hundred facilities who would be our clients.
On the home care side, different business to Health Workforce Solutions, but they do complement each other. What we are doing is we're looking after people in the home, and we do that by providing either nursing services, but also domestic services. And that is not just all the elderly, it could be children, disabled, so it's that broad range of the community.
You've seen in Australia over the last 15, 20 years, it's all about scale in HCA, essentially following that same development program. It's about scale and developing corporate capabilities to match off with the corporate customers that we deal with.
We look at Ramsay, we look at Healthscope, all are interested in the Healthcare Australia model because they are talking corporate to corporate.
It's what people used to know as nursing agencies in the past, but we're different.
We use Healthcare Australia for many different reasons. Obviously, staff shortages are one of those.
I've got an RNP for night duty tonight. We've got Jenny Yields.
Also more strategically for providing extra support to sites when they're under pressure, or the implementation of new staffing models so they can come onto the site and provide support.
Understand what your deficit is. We understand that you're looking for people who can hit the ground running. It's about giving that professional corporate level of service, but not forgetting the person that you're dealing with.
It comes down to listening to clients and not just signing up a contract, building rapport.
I understand the nurse's perspective as a client, and I also understand the facility's perspective. I've run hospitals before, and for the client it's all seamless.
We are part of our national link team. If somebody rings, there's an issue, they're quite easily able to access the data on the electronic system.
We're a national call centre, so we're operational 24 hours a day. As the need arises, we can step up and take on whatever we need to on a national level.
We can offer more shifts at more times, at more places than anyone else in the industry by a factor of 3. And that's in more specialties. And so for a nurse, that's relevance.
I really love the flexibility and the variety. The biggest thing for me is being able to go online and choose my shifts. No night shifts and no weekends.
I've worked for ASEPS for 7 years full-time, then had a baby recently, and I now work 1 to 2 days a week.
So in a sense we have 2 lots of clients because we're acting as agents for the nurse and also for the facilities.
Nursing is so much more now than it ever used to be. Because of that, we have to offer a very high level of training and education. So we make sure that every nurse and carer can maintain the standards that are expected of them out there and by us. And our courses are really highly regarded and we get fabulous feedback.
They're all under the challenge of change. The education service is a way of meeting those challenges. Online learning at e-nursing is related to that professional development.
I just really like the fact that they have good communication. I can put my shifts online. I find the staff really friendly, and they provide education sessions like this, so it's just easy to tap into everything you need to. So yeah, it works for me.
They can actually keep their competencies up to date. They can do that with us. Do it online, do the tutorials and do the online assessments. We can give them variety and ongoing education and training. We are a people-based business at Healthcare Australia. It's all about people. We don't have any other assets other than our people, and they are incredibly valuable to us, because being a people-based business, you actually have got to continue to provide that point of difference that people will see, I want to work for Healthcare Australia. And we believe that with the people we have, with the offering that we have, is that people want to be with us and want to work with us, and clients want to actually have a relationship with us. So that's the essence of where we are.